What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, a flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for COVID, flu, or any of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Tuesday edition of the Virus Update for Tuesday, April 29th, 2025. If you're new to my channel, welcome to my channel. You have clicked onto the channel that gives you daily virus updates on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there. You need to be informed with what's going on with each and every one of them. That's what I do here on my channel. I try and find any news I can find, the latest data. We take a look at wastewater. Yes, viruses can be measured in wastewater. We look at all this information to help keep you informed and safe from what's going on in your community, not just in the United States, sometimes various different countries around the world. And we're going to talk about several of them today. So want to stay informed? Subscribe down below. Help me reach my goal of 10,000 subscribers by the end of this year. Hit that thumbs up button down below if you like this video. Hit that notification bell. Share this video with anyone you know. And leave your comments in our comments section down below. I'm sure there'll be a lot of discussion on the various different topics that we talk about today. Already, we do have several news stories today. Matter of fact, there are so many news stories today, I just stopped doing searches before I started this video. I said, you know what? Enough's enough. Yeah, there's a lot of stuff to go over. This is one of those days where the news portion of the video could go over 10 minutes. And then we, of course, have a lot of our daily data, and I would like to get to some wastewater as well to fill in some of those gaps for maybe areas in the United States that I don't talk about today. So, yeah, let's get right into things, shall we? Whooping cough cases surge in Tennessee with 235 reported so far this year. Yeah, that's right. The Tennessee Department of Health said that throughout 2024, the state saw 389 cases of whooping cough. So think about that. They saw 389 all of last year. They're already at 235 cases this year. Yeah, I think at this rate it's safe to say, unless someone intervenes or something, I think it's safe to say, unfortunately, they are going to go over the number of cases they had last year. Yeah, this is not good whatsoever, and we do have more whooping cough news. This is from the World Socialist website. Whooping cough cases surging towards a 70-year high in the United States. Yeah, whooping cough cases are just, they're not going good. Let's read some of this. Cases of whooping cough, or pertussis, as it's more formally known, have been quietly but strongly surging to pre-pandemic levels and beyond. The Centers for Disease Control and Prevention Nationally Notifiable Disease Surveillance System, NNDSS, found there have been, get this, 8,845 cases of pertussis in the United States so far this year, and the number is rapidly expanding. I think at this rate, it's safe to say we're going to come close to, if not go over, last year's number in the United States. Yeah, that's not good whatsoever. All right, moving on now to our next story. Now we're talking about bird flu here, and I believe this is in Stutsman County. This is in North Dakota. They are announcing that state officials have confirmed the presence of bird flu in Stutsman County. I hope I'm saying that correctly. I think I am. Backyard chicken flock. Yes, it's been a while since we've talked about bird flu. We talked about it a little bit last week, but we talk about the migration of birds, and with that come the increased chances of bird flu spreading, and we're starting to see just that happen. All right, moving on to this. In New York State, State Department of Health declares flu no longer prevalent in New York for 2024-2025 season, and though they're saying that there is still the risk that flu can still be going around, and it's not back to baseline yet in many different places, with influenza cases in New York State continuing to decrease. This is from the article. The health commissioner has announced that the flu is no longer considered prevalent for the 2024-2025 season. The decision removes the masking requirement for healthcare workers who have not been vaccinated against the flu, according to the New York State Department of Health. And I have to go back and look at it. Yep, this is 2025. I didn't even know there was a masking requirement for people who did not get vaccinated for flu in New York State. Did you know that? We're learning something here every day. we learn new things. You learn things, I learn things here when we do these videos. And I did not know there was a masking requirement for healthcare workers in New York State. But again, I stress, with the way things have been lately, not going back to baselines, talk about this a ton here on the channel. I highly stress, don't act as if there's no flu out there. You can get flu. I really don't want to say it all year round, but it's starting to become to the point where if you get flu in the summertime, should it really surprise you? Probably not at this rate anymore, the way immune systems are being impacted by COVID. All right, Arkansas. Health Department reports evidence of community spread of measles. This is the first of several measles stories for today. The Arkansas Department of Health on Tuesday reported the state's fourth confirmed pediatric measles case in an Arkansas resident because the child did not travel outside the state. This indicates the first case of community spread this year, according to a press release. As we know, measles is a highly contagious virus. Moving on to this now. Now we're going over to Texas. Contact tracing begins as new details emerge in Travis County's second measles case. And I have to take a look here. Again, this is April 28, 2025. As we know, Travis County has had several measles cases. But this year it's saying second. We'll look at the dashboard for measles in Texas in just a moment. And basically what they're saying here, they're talking about more potential locations of where measles has spread. So there's a lot of different places. UPS store in South Austin's one of them. There's several different places. I did tweet this out on X. I did post this over on Blue Sky, and I'm going to make sure it makes it over to the website as well, so you can go and read all of those various different locations. I'm not going to sit here and read them all. Take a look at this. West Texas A&M University confirms case of measles on campus. Yikes, this is not good. West Texas A&M University has been notified of a confirmed case of measles exposure involving a university employee. According to WT, West Texas employee was present on campus on April 21st. University officials say they are working closely with the Amarillo Public Health Department to ensure appropriate follow-up and risk mitigation across the community. Yikes, that's not good. All right, here's the full update for Texas. Some slightly good news here. Not perfect, but the increase in measles today, it's not as big, but nonetheless, it's still an increase. At this time, 663 cases have been confirmed since late January. This is an increase of 17 since the April 25th update. It's going down slowly, but I mean, I think it's going to fluctuate. We'll have to see what happens here. 1% or fewer than the 10 of the confirmed cases are estimated to be actively infectious since their last rash onset date was less than a week ago. 87 of the patients have been hospitalized. This is the total number of hospitalized patients over the course of the outbreak. It's not the current number. Today's report includes 23 additional hospitalizations from earlier in the outbreak. At 23, that's a significant size increase when it comes to number of people who have been hospitalized for the virus. All right, taking a look at what's going on with the various different counties reporting cases. We can see here Dawson has 25 cases, Ector 10 cases, El Paso 32 cases, Gaines 396 cases, Lamar 17 cases. Lubbock is reporting 48 cases. And you know what I'm noticing here? Travis County. And let's do something real quickly. Let's type in, oops, that's not correct. Let's type in Travis. All right, here it says Travis 1 case. So this new update is not including that Travis is now 2 cases. I apologize, folks. I thought Travis had more cases. I thought it was one of the ones that we were reading with a lot of cases. Maybe it was Terry County that I was thinking of that now has 59 cases. Now take a look at this. Unfortunately, there seems to be more not fully vaccinated, or partly vaccinated and fully vaccinated cases. So 12 1-dose and 16 2+ doses. Yeah, that's a little concerning. And I was seeing something someone posted the other day. Could some of these vaccinated cases be people who have had COVID several times? I suppose that's possible. I'm not going to speculate, but yeah, there's a few more of those cases popping up. But still, the large majority have been unknown status or vaccinated. 635 of the cases are unknown or unvaccinated status at this time. So, once again, a measles update there for Texas. And now we got more measles updates. 5 new measles cases confirmed in Belize at this time. So that is not good yet. They are reporting more, and I thought they had the total number for the season here. Yes, they do. It looks like this brings the total number of confirmed cases to 7 cases there, I believe, in Belize, or maybe it's a certain area in Belize, but nonetheless, yeah, measles cases rising there, and I thought we had another measles, here we go. I knew we had another measles story. As measles cases surge, Mexico issues a U.S. travel alert. The border state of Chihuahua has recorded 713 confirmed cases, with its outbreaks linked to the ongoing cluster of cases north of the border in Texas. Yikes, that's not good. As the U.S. struggles to contain its worst measles outbreak in years, cases have spilled over into Mexico. In an April 25th report, Mexico's Ministry of Health reported there have been 583 confirmed cases in the country this year, 560 recorded in the border state of Chihuahua on April 27th. And it looks like that case number has gone even higher to 713. Now to that story that I was about to show. Man who had COVID for 290 days, 290 consecutive days, has died years later. Yeah, I would think if you're testing positive for that many days, there's got to be some sort of damage going on. Dave Smith, 76, died peacefully at his home in Bristol. I believe this is over in the UK. This is from the BBC. On April 1st, his family said the BBC understands he did not have coronavirus at the time of his death. Yeah, wow, that's really a long... Let's read some more of this. Mr. Smith, who was a pub and club performer, made headlines around the world after contracting COVID in May 2020 and being unable to fight it off for 10 months. He was dubbed a miracle man by doctors for surviving the virus, which saw him hospitalized 7 times and left him with 51% of his lung capacity. Yikes, that is really sad. In 2021, scientists at the University of Bristol studied Mr. Smith's case to try to understand how COVID acts and mutates within the body. He described his experience of having COVID as like someone has pulled the plug and life is just draining out of your body. Yikes. We're not going to read any more of this, but really sad what has happened there. And now he has unfortunately passed away. All right, the COVID update out of New Zealand. COVID-19 current cases. In New Zealand at this time, they are reporting 37. A new case average, 102 under rats. Cases in the hospital, 28. ICU, yet again, no number for that. Deaths attributed to COVID, 1. Total deaths, 4,636. And let's see here. New cases, 305. Reinfections, 192. And deceased down here, it says 9. I can never understand why that will come up as a higher number than what's up here. Makes no sense to me. So is it really 1 or is it 9? If anyone understands it, let me know down below. Maybe it's just going straight over my head. I honestly do not know. All right, another news story. The last news story. Alberta's flu death toll highest in at least 16 years as vaccination rate drops. Alberta Medical Association calls for beefed up immunization campaign this fall. According to some of the data, 193 Albertans have died due to influenza this season, surpassing last year's total of 175. Yikes, that's the highest since 2009, they're saying. Taking a look at the wastewater activity levels in Canada, COVID-19 is moderate, flu A is moderate, flu B is moderate, and RSV is low at this time. Who knows? Maybe the new Prime Minister who just got elected, or the new person who just got elected in Canada, maybe he'll take these viruses more seriously. Or they will. I don't know. All right, taking a look at what is going on with my website, let's refresh. Do I have anything to show you here? I'll be honest with you. I haven't looked at it this morning. I was busy all morning long. Nothing to show you here. I may do some work on the site later on. Taking a look at what is going on with bird migration traffic. Remember yesterday, it got to around 400 million. Let's see if that happens again today. Wouldn't surprise me if it does. We're in the peak right now of birds migrating north. And take a look at that very high bird migration traffic in the east. Yeah, it goes to, wow, over 500 million birds have migrated north, which means the risk of bird flu spreading is definitely going to continue. Wow, that is just amazing how many birds have migrated to the north. All right, taking a look at what's going on with air qualities, if we can. There we go. We can see here that along the, we'll say not the east, yeah, we'll include the east coast, from say about the 995 corridor down to the 85 corridor on north and west up into the Great Lakes. There are some air quality issues today. Some yellows, even a few oranges showing up, and some yellows and oranges showing up on the west coast as well today. Pollen levels, they continue to be an issue in many different places. Haven't talked about anything weather in a while, and I have started posting over on my climate data report account on Blue Sky and over on X once again. Going to continue to do that. May even do a few YouTube shorts over on that channel as well. Here and there if I see something that's interesting. I don't think I'm doing full-length videos like I'm doing here on this channel. In Pinellas County, Florida, we do see here that there are a few calls going on right now. Not as busy as the past few days. 2 sick person calls and a couple other things at this time. Taking a look at what happened in Philadelphia on Monday. Yeah, yet again, another high call volume day. 849 EMS incidents. Let's see what's going on in Montgomery County. And that's up to 16 calls. A little busier than when I checked it about 10-15 minutes ago. We'll say 20 minutes ago because this video is now in 16 minutes long. And we can see here, yeah, just various different things going on. Hopefully things look better in Chester County. There were a lot of respiratory calls a little bit ago. You know what? There still are. Look at this. 1, 2, 3, 4, 5 respiratory difficulty calls. Sick person call, stroke. Yeah, I'm concerned about how many respiratory calls there are there. Let's check the hospital situation. Of course, I'm going to be concerned about this a lot. First off, York, Pennsylvania does have something going on there. And let's see, Chester Crozier Medical Center, which, by the way, that should be closed at this point. But I guess the final day up. Okay, yep, this is just a part of it. Closing down, that's what that message is about. We have to watch these suburban hospitals. You can see here, anything in red, no good. Not going to do you any bit of good for emergency department. We still have overcrowding being listed here at Mainline Health Riddle Memorial Hospital. But take a look to the west. Look at this huge gap here. There's Lancaster, and there's all this space in between. There is nothing there in terms of hospitals. So, I mean, this is a real big problem. I wish someone who was very wealthy and had a lot more money than they know what to do with would donate some money to put another hospital and get some hospitals going in this area of Pennsylvania, because it is a real problem. Speaking of Pennsylvania, we need to take a look at what's going on with the Pennsylvania update today. Wastewater for COVID is low at this time, and let me refresh this to the statewide level. There we go. It is low at this time. We can see here, though, and maybe you can't see. I'm going to try and correct this. You can see we're still above the baseline. That's not a good thing. Taking a look at the latest variant, LP.8.1, influenza A. Again, that is above the baseline as well. That is now listed at very low. And RSV, still above baseline, is also listed at very low at this point. And here's the rest of the update from Pennsylvania. But before we get that, let's pause for a second and let's do a hydration break, shall we? Today's drink of choice is water. Very important to keep yourself hydrated. Alrighty, taking a look here at the rest of Pennsylvania's update. Influenza trends. Activity is low, and everything continues to drop at this time when it comes to influenza. The percent of emergency department visits resulting in an influenza diagnosis are low statewide, and 986 influenza deaths have been reported this season. RSV activity is low, and COVID-19 trends. Yeah, everything is good with COVID. COVID is decreasing at this time. Not seeing any signs of that summer surge just yet. All right, taking a look at what's going on in New Jersey. And we did just see here, Inspira Medical Center in Mannington is having some sort of a specialty issue at this time. Taking a look at New York State, and I need to refresh this because it went blank on us. 461 new cases reported. When we take a look at what's going on with New York State hospitalizations, and we can see here, they are up slightly from where they ended last week. 727 hospitalizations and 64 people in the ICU at this time. Taking a look at what's going on with Walgreens this week, the positivity rate for COVID was 16.2%. That's a difference of up 0.1%. And again, testing did go up ever so slightly this week. We did not look at flu yesterday. We got to look at it today. Walgreens flu data, 1.66% positivity rate, and I see a few states sticking out. First off, Washington State, the flu positivity rate is 6%, and I'm also seeing Utah is at 5%. Louisiana, 4.55%, and Connecticut is sticking out today. Yikes, look at Connecticut. That has jumped up to 6.52%. That's out of 23 tests. What's going on in Florida? Florida is 2.33%. Illinois is 2.72%. Then we do have some states that are not doing bad. California, 1.18%. Texas looks like it's doing good. Yeah, 1.15% in Texas. And what's going on in Tennessee? Tennessee currently is 1.83%, and New York State down to, wow, 0.36%. So remember, New York State said that they're they're saying that it's under control now, and I think flu very well may be under control in New York State. All right, let's refresh Wastewater Scan because there may have been an update. I did not have a time to look at it today, but let's just take a look at the nationwide levels. And okay, we're seeing these wonky movements once again. COVID nationally is medium at this time. RSV is low. Influenza A is low. Influenza B is listed high. HMPV is high. EVD68 is low, but it's gone up. And norovirus is listed in the high category at this time. Taking a look at what's going on for the West Coast. The West Coast, a little bit of an increase for COVID. Not terribly concerning at this time. Low for that. Low for RSV. Influenza A is low. Influenza B needs to come down. That's still high. HMPV also needs to come down. EVD68 is low, and norovirus is medium. In the South at this time, we do see levels are low for COVID, low for RSV, pretty much low across the board with exceptions to norovirus. In the Northeast at this time, COVID, it's listed in the high category. Again, we talk about baselines, and right now, when we take a look at this, that baseline's still up, so we need to get that down before the next wave comes. RSV is low, Influenza A is medium, Influenza B is high, HMPV is high, EVD68 is low, and norovirus is high. And when I talk about baselines, going backwards for a second, look at New York State. I mean, remember when things were way down? You know, in the 300s for hospitalizations, and then back in the 400s? We still need to get this down before the summer wave comes. All right, last but not least, the Midwest. Take a look at this. In the Midwest, COVID is listed at medium, RSV is still high, Influenza A is low, Influenza B is still high, and overall it's still going up. HMPV high and still going up, EVD68 is low, and norovirus high but dropping at this time. Alrighty folks, if you enjoyed today's update, give it a thumbs up. If you're new, subscribe down below. Hit that notification bell. Share this video with anyone you know, and of course, leave your comments down below. We will have another update again tomorrow. It may be slightly later. I have an appointment with my pulmonologist/sleep doctor. It's for sleep-related reasons. We're going to get the study results from my sleep study, and who knows, do I have sleep apnea? Did COVID cause me to have chronic fatigue? I don't know. I'll see what the deal is going to be about that tomorrow. And one other thing, I am considering maybe down the line, not this week, but down the line, maybe doing some sort of a live virus update where I do the virus update live and then I chat with you guys in the chat area. Let me know down below if you would want to see something like that. It's something I'm considering. I've seen other channels do things like that for various different things. Who knows? Maybe it'll help grow the channel. I honestly don't know. And if it works out, maybe it'll be something that we do regularly at like a set time each week. I don't know. Let me know down below and maybe I will consider doing it. All right, see you guys again tomorrow. Stay safe, everyone, and thanks for watching.